In the facial locoregional anesthesia techniques, the mandibular block involves targeting the V3, the third branch of the trigeminal nerve. For specific equipment, a 50 mm echogenic needle and a long-acting local anesthetic, in this case narrowpin, potentialized by intravenous dexamethasone, are used. A linear probe with a depth setting of 4 cm is also employed. This ALR is performed under general anesthesia. The procedure begins with the patient's head position and the ultrasound machine at shoulder height. The ultrasound probe is placed under the zygomatic arch, just in front of the external auditory canal. The approach to V3 is through the mandibular notch, located between the coronoid process anteriorly and the condyle of the temporomandibular joint posteriorly. The mandibular nerve travels within the pterygomandibular space, which is superficially bordered by the masseter and deepened by the lateral pterygoid muscle, both visible on ultrasound. Opening the mouth with a Gettle cannula facilitates the visualization and access to the pterygomandibular space. A left mandible block is performed on a patient with a spontaneous open mouth. The linear probe is placed under the zygomatic arch, allowing direct visualization of the pterygomandibular space. Before puncture, a Doppler scan of the maxillary artery is conducted, which may not always be visible. 2 bony landmarks, the condyle of the temporomandibular joint posteriorly and the coronoid process anteriorly, frame the mandibular notch. Between these landmarks, the pterygomandibular space is visualized. The out-of-plane approach involves puncturing 2 mm from the probe, aligning the midpoint of the probe just anterior to the maxillary artery if identified. The needle progression is visualized, followed by an aspiration test and fractional injection of local anesthetic to achieve a biconvex lens dissection of the pterygomandibular space. 5 ml of narrowpin are injected in both sides. Similarly, a right mandibular block is performed on the patient.